volunteer driver programme is a key part of delivering quality care for cancer patients in Ireland. But with the advent of the coronavirus and all of the extra precautions that we have to take, we thought we'd do a short video just to outline to our amazing volunteer drivers and to the wonderful patients that they bring to hospital how best to deal and manage with the transport of patients to their appointments. A few days before the booking, the volunteer driver will get an email confirming the arrangements for the booking, but we'll also ask them a number of questions just to tease out whether there might be a risk of coronavirus either in them or in a family member. If you answer yes to any of these questions, it doesn't mean that you have coronavirus, it just means that we need to be a little bit more careful and maybe look to reschedule you for another time. On the day of the appointment, if either the driver or the patient have developed any colds or coughs or sniffles, they really need to get in contact with us again so we can reschedule and make sure that there's no risk that either a driver or a patient could contract the coronavirus. So now let's move on to preparation of the vehicle on the day of the appointment. And what we're trying to do here is make sure that there's no possibility that the patient or driver might come into contact with any virus droplets. The car itself, the manufacturer will have recommendations as to the type of materials that can be used for cleaning. So you need to make sure and follow the instructions that are relevant for your car and the types of materials that you will find in your car. We should start in the back of the car, cleaning and wiping all of the surfaces that the patient might come into contact with, paying careful attention to places like the safety belt, the door handle, and maybe the seat in front that the patient might grab onto as they're adjusting their position within the back of the seat. We don't need to worry about using harsh chemicals. Soap and water is fine. Plain old kitchen spray and kitchen roll, they'll all do fine. As we leave the back of the car, we need to give the door handle a wipe as well, bearing in mind that the patient will probably come into contact with that surface as well. Then the driver needs to go into the driver's seat, give the steering wheel and any other surfaces like the handbrake, the gear stick, a good wipe again with the same cleaner, clean the door handle, and then give their hands a good wash in either soap and water or alcohol-based hand gel. And that's it, that's the car clean. Any droplets that might have been in the car have been disinfected and we're good to go. So the driver will now proceed to the appointment and to the house where the patient lives. Remember that the patient and any companions that are travelling with them need to play their part as well and make sure that they have washed their hands thoroughly before they leave the house. The driver might like to offer their arm if the patient is a bit infirm. The patient should sit in the passenger side in the back of the car. Hospitals are now restricting companions and visitors into the hospitals to try and reduce the risk of bringing in coronavirus. But if the patient has a wheelchair, a companion will need to travel with the driver. The companion should sit behind the driver, having put the wheelchair into the boot of the vehicle. So we're all good to go on our journey. All surfaces are clean. The patient, the companion and the driver have cleaned and gotten rid of any virus droplets, and it's now safe to proceed with the appointment. On arrival at the hospital, the patient and the companion will head to the location of their clinic. Remember though that some hospitals have recently moved their clinics to reduce the risk of contamination with coronavirus, so you might need to just double check where your appointment actually is in the hospital. The driver will need to take a break, obviously, while they're waiting for the patient to have their treatment. So if you go to the bathroom or if you're handling money or maybe getting a coffee, remember that you need to wash your hands before you go back into the car. You can wash them either with plain old soap and water or alcohol-based hand rub. So once the treatment is finished, the patient and any companion will make their way back to the car. It's important that they remember to wipe their hands before they get back into the car as well. So that can be achieved with either plain old soap and water or alcohol-based hand washing before they get into the vehicle. On return home, the driver can open the door and maybe offer them an elbow to help them get out of the car, and they can go into their home and have a well-deserved rest. When the driver returns home, it would be a good idea to give the car a final once-over. wiping all the surfaces that the patient or their companion might come into contact with, dumping any rubbish, any water bottles or any wipes that have been used into the bin, and giving your hands a good thorough wash, soap and water or alcohol-based hand rub before you finish for the day. So to finish up, on behalf of the Society, I just want to express our appreciation to our amazing army of volunteer drivers. You do so much to make sure that cancer care can be delivered at this difficult time for everybody. So to recap on our key points. Coronavirus is a bug that's passed from person to person by droplets, and we can kill those droplets with standard soap and water. Remember the 4 weapons we have to prevent anyone from getting infected. Don't travel if you have symptoms. Remember your cough etiquette. Kill the droplets on surfaces and on your hands with standard cleaners or soap and water. And keep your distance as far as practical. For your journey, prepare the car as you were shown in your training, paying particular attention to the contact points like door handles. When you and your patient leave the car, make sure you both wash your hands last thing before you re-enter the car. Have a safe trip and do make contact with the team in the Irish Cancer Society if you have any questions at all.